has a marked effect on sufferers, on the society, due to its prevalence and economic consequences. But if you're unfortunate enough to suffer from back pain, how can you tell if your back condition is due to a serious spinal injury, which luckily accounts for only about 1% of back pain, or another systemic illness such as tumour? The back is a complex framework, and the lumbar spine, or the lower back, is a remarkably well-engineered structure of interconnecting bones, joints, nerves, ligaments, and muscles, all working together in synchrony to provide support, strength, and flexibility, thus allowing your center of gravity to be maintained over a constantly changing base of support during functional movements. However, this complex structure also makes your lower back vulnerable and susceptible to injury and pain. Well, it is quite difficult to make an accurate diagnosis as to the exact nature of back pain, even with the use of the latest imaging and other type of tests. Doctors are often unable to pinpoint to the precise cause. On the other hand, it is possible that imaging tests such as MRI will show problems in the spine of a patient who has no back pain at all. So, back pain is therefore a symptom rather than a disease on its own. Most back pain is musculoskeletal in origin, although pain that arises from other organs may be felt in the back. Many intra-abdominal disorders such as appendicitis, aneurysm, kidney disease, bladder infections, pelvic infection, cancer, and ovarian disorders can cause pain that is referred to the back. But these rarely present as back pain alone. There are nearly always some associated gastrointestinal, urinary tract, or other symptoms. For example, a previous dental patient of mine had experienced low back pain for months and has rightly sought medical advice. Unfortunately, his general practitioner dismissed it as pain which was being caused by muscle overexertion, and he simply told him to rest. As expected, the condition persisted and worsened, and months later, his back condition was diagnosed as being caused by pancreatic cancer. Now, finding the optimal treatment for lower back pain very much depends on obtaining a correct diagnosis that identifies the underlying cause of the problem. Although it is not the intention of this short video to offer you any diagnosis or treatment, the general consensus is that if you suffer from any form of lower back problem, especially when it is persistent or exhibits the following symptoms, you must seek immediate medical attention. Symptoms such as history of cancer with recent weight loss not due to lifestyle change such as diet or exercise, fever and chills, pain from your lower back beginning to refer elsewhere such as down your buttock and legs, severe trauma, significant leg weaknesses, loss of bladder and bowel control, severe continuous abdominal pain and back pain. Additionally, if you experience pain after a major trauma such as a car accident, or if your lower back pain is so severe that it interferes with your daily activities, mobility or sleep, or if there are any other troubling symptoms, you should seek immediate medical attention. The most common cause of lower back pain is musculoskeletal pain, which is generally caused by muscle dysfunction. That is, when muscles are not contracting properly or applying the right amount of force during contraction. But where there is no specific pathology, such as nerve compression or herniation of discs. Back pain has a marked effect on sufferers, as well as on the society, due to its prevalence and economic consequences. But if you're unfortunate enough to suffer from back pain, how can you tell if your back condition is due to a serious spinal injury, which luckily accounts for only about 1% of back pain, or another systemic illness such as tumour? Generally speaking, if your pain persists for more than 6 weeks, is constantly intense, get worse, or is accompanied by any other symptoms that we mentioned before, you must seek immediate medical advice. And those who suffer from musculoskeletal back pain may recall these familiar symptoms Generally, the pain varies with time and physical activities. The back is usually stiff in the morning, but after you have been moving around a bit, it improves. Conversely, for non-musculoskeletal causes of lower back pain, the discomfort tends to be constant. Rest and exercises do not relieve it, and you may not be able to find any position of comfort at all. Musculoskeletal back pain does not affect general health, such as causing fever or sudden and unexpected weight loss. Musculoskeletal lower back pain usually present in patients between 20 to 55 years of age. Patients who present before the age of 20 are more likely to have a serious disease or structural problems. Patients who develop new or different back pain after the age of 55 are more likely to have a serious disease, in particular, form of cancer that has spread to the spine or osteoporosis. The majority of sufferers, including myself, tend to have recurrent symptoms because this type of back pain is strongly associated with trigger points. Trigger points are the primary cause of pain in at least 75% of cases and are a factor in nearly every painful condition. Without intervention, trigger points do not disappear. They will simply turn latent and can be reactivated with the slightest stress or strain. And this explains why, although acute episodes generally settle down, even without treatment, the pain may not fully disappear and recurrence is common. It is therefore important that you do not simply concentrate on the elimination of pain, even though it may appear to be the most urgent thing that is needed, but that you manage the condition effectively. If you'd like to know more about how to prevent low back pain and how to manage your long-term condition, please take a look at my book, A Practical Guide to the Self-Management of Lower Back Pain, which is now available from Amazon. Thank you.